Dr. Goodin with stress, physical, and mental health. When we talk about health psychology, um, it's concerned with the effects of stress and other psychological factors on the development and maintenance of physical problems. It is a subspecialty of behavioral medicine, with psychological factors predisposing a person to medical issues. These can be life issues, personality traits, particular coping styles, and lack of social support. When we talk about stress, of course, the most dramatic thing that comes to mind is PTSD, post-traumatic stress disorder. Exposure to extreme and traumatic stress may overwhelm the coping resources of otherwise apparently healthy people. So, we're going to be talking about stressors, the things that stress you. Stress, the general idea of all the stressors combined. And then coping strategies, which is how we deal with stress, some of us better than others. Selye was a psychologist who defined good and bad stress. Good stress was called eustress, that's EUSTRESS, and bad stress is what we know as distress. People interpret situations differently and thus have varying amounts of stress. Protective characteristics they may have include optimism, psychological control or mastery, self-esteem, social support. And our genetic makeup makes us more or less stress sensitive. Early stress experiences influence later stress experiences. And also, you may have noticed in your life that phrase, the straw that broke the camel's back. It can build up, stress can build up, and then one little thing can really make you sick or make you angry and put you into a temper. Um, Stress can accumulate. We have stress tolerance. That's a person's ability to withstand stress without becoming seriously impaired. And stress affects the way we perceive other factors in our life, our cognitions. The depressed person thinks like a person with fever, sees everything negatively. So, with regard to the characteristics of stress, we look at severity of the stressor, chronicity, timing, relevance, expectations, and controllability. A crisis is an acute stress. It refers to times when a stressful situation threatens to exceed the adaptive capacities of a person or group. A traumatic situation, like a crisis, overwhelms a person's ability to cope, while stress may not. Life changes may include a new job, marriage, baby, good or bad things, and can trigger problems, including onset of a disorder. LEDs refers to life event and difficulty schedule. The rates that can be both acute and chronic forms of stress and allows consideration of a person's unique circumstances when rating each life event, i.e., their resources. Personal growth in the face of tragedy is something we often note. It's called the silver lining. Seeing the good or the value in a disaster moderates the effects and allows adjustment to the changed circumstances. That adjustment can also be called accommodation. When we're talking about stress and the stress response, we talk about SAM, or sympathetic adrenomedullary system, designed to mobilize resources and prepare for a fight or flight response. The hypothalamus and sympathetic nervous system, or SNS, and the adrenal medulla secretes adrenaline, or epinephrine, and noradrenaline, which is norepinephrine, which circulate in the blood and increase heart rate to metabolize glucose more quickly. HPA refers to hypothalamic pituitary adrenocortical system that releases hormone called corticotropin relating hormone, or CRH. This stimulates the pituitary gland to secrete adrenocorticotropic hormone, or ACTH, in the adrenal cortex, producing the stress hormones called glucocorticoids, or cortisol as we know it. Cortisol is what prepares the body for flight or fight. It inhibits the innate immune response. So escape normally does not have priority over healing, but in this case it does. I want to note that if I want you to learn these big words, which is quite unlikely, I will tell you. But at this point, just want you to understand the main ideas. In everything I teach you, the first go-to in studying is for you to try to understand the main ideas. There are biological costs of stress. We refer to the allostatic load. When stress and pressure rises, our allostatic load is greater. Emotional stress may lead to decreased immune response. Then we have our mind-body connection. Psychoneuroimmunology is the study of the interaction between the nervous system and the immune system. Immune issues may also affect mental states in return. Glucocorticoids cause stress-induced immunosuppression, which is only good for a short period of time. The immune system protects the body, of course, from such things as viruses and bacteria. There are white blood cells called leukocytes or lymphocytes, and the B cell produces specific antibodies for specific antigens, foreign bodies. T cell circulate in blood and lymph systems, and they're activated by cytokines, or chemical messengers released by macrophages. It can take more than 5 days to produce an antibody, but immune response is much faster if the same intruder ever attacks again. So it has sort of a memory of the intruder. If you get a little sick with something, fight it off. Next time if it's the same bacterium that attacks you again, you're going to fight it off more quickly in the future because you recognize the intruder. Attitudes play a role with health. Optimism buffers against disease, while hopelessness is tied to disease progression, such as atherosclerosis. Some doctors wait to perform surgery until a patient is actually optimistic about the outcome. Negative affect, of course, affect means emotionality, also plays a role. Negative emotions are associated with worse health and immune functioning. History of or current depression increases the likelihood of heart attack, death, osteoporosis, and muscle strength. Positive psychology focuses on human traits and resources that might have direct implications for our physical and mental well-being. Cardiovascular disease, or CVD, is the leading cause of death in the U.S. Stress, or cortisol, causes constriction of blood vessels, so the heart must work harder. Pulse quickens and blood pressure is higher. Hypertension is when there is elevated pressure during the contraction of the heart, or systolic pressure. Essential hypertension has no physical cause. It's due to stress. Increases the likelihood of stroke or heart attack. Hypertension is more common among African Americans due to socioeconomic status, biological makeup, and lifestyle. Hypertension is exacerbated by how anger is communicated, whether it's constructive or not. Long-term stress increases the risk of heart attack and doesn't have to be severe or extreme stress. Risk and causal factors in CVD include personality. Type A behavior especially is more likely to have heart problems, mainly due to their hostility, whereas type D are more often to have negative emotions, also more likely to have heart problems. Depression and anxiety are also tied to heart problems, as is isolation and lack of social support tied to heart problems. Treatment of stress-related physical disorders involves stress management, which is important for physical health. Emotional disclosure is sort of the idea of opening up. It helps us manage stress. Um, so even writing problems down may lead to emotional catharsis. Biofeedback is a way of monitoring the body and giving the patient feedback cues. Relaxation and meditation both help decrease stress. In terms of psychological reactions to stress, stress may cause disorders, such as adjustment disorder or even PTSD. In PTSD, the stressor is accompanied by fear, helplessness, or even horror. In adjustment disorder, the psychological response to a common stressor, such as divorce, death of a loved one, or loss of a job, results in clinically significant behavioral or emotional symptoms. It disappears when the stressor ends or the person acclimates. It's the least stigmatizing or the mildest diagnosis. PTSD is a normal response to an abnormal stressor. It may begin as acute stress disorder until it has lasted a month, then it receives the PTSD diagnosis. It causes a pathological memory with three characteristics. First, recurrent re-experiencing of the traumatic event through nightmares or intrusive memories. Second, avoidance of stimuli associated with the trauma and emotional numbing. Third, increased arousal, which may involve insomnia, the inability to tolerate noise, and an excessive response when startled. 6.8% of the U.S. gets PTSD, but almost 3 times as high in women, regardless of the type of trauma. Human intent traumas such as rape and abuse are more likely to result in PTSD than natural disasters and accidents. The military is a cocktail of circumstances for lowering mental health and increased likelihood of PTSD. Substance abuse and aggressive behavior are more common. Some are more vulnerable to PTSD. Anxiety and depression make PTSD more likely, while higher IQ is protective against PTSD. A small hippocampus increases the likelihood of PTSD. PTSD is less likely when trauma is justified. So if the military believe that the war is in fact justified. Identification with the military unit decreases the likelihood of PTSD. Stateside support protects against vulnerability for PTSD. PTSD is an overwhelm of our coping mechanisms, resulting in a cycling of traumatic cognitions. I have a little bit more here. Prevention and treatment may involve stress inoculation, which is training that prepares people to tolerate an anticipated threat by changing the things they say to themselves before the crisis. People in different occupations seem to be more or less vulnerable, such as the policeman at the World Trade Center. Sometimes time, family, friends, church, and community will help trauma experiences to dissipate. Remedies may involve telephone hotlines, psychological first aid, crisis intervention, psychological debriefing, medications, and cognitive behavioral treatments. A few are trained in mental health, so psychological debriefing is not always possible. Medications may involve antidepressants, antipsychotic medications. Cognitive behavioral treatments may use prolonged exposure, wherein the patient is asked to vividly recount the event over and over until there is a decrease in his or her emotional response. Of course, there's a high dropout rate because of the reliving of these horrible experiences. Other techniques seek to remove the attribution that the threat is still current. Virtual reality exposure treatment helps soldiers relive the experience without going to a doctor, because there's a lot of stigma surrounding that doctor visit. A history of a history of trauma predicts mortality. Thank you very much. See you next time.